We just started. Hello, hi everyone. Um, I am back with another podcast. I have got a lovely, lovely friend here who who I will let her introduce herself. But it's really nice to have friends on the podcast because you actually get to have fun and you get to chat and it's an excuse to do it. So yeah, over to you, Abby. Introduce yourself.
Okay. I just got that meme from the in-betweeners, like, oh, friends.
We're such losers. You guys were such losers. It's just like so excited to have friends.
Okay, I'm Abbie. And I'm an ST1 in emergency medicine training, and don't know what else you need to know. I'm 28 years old. There you go.
Yes, this is Abby. She's an ACCS SD1 emergency medicine trainee. She's really cool. She has a cat and she likes to knit. And she can drive. Like,
That sums
yeah,
up coolness, doesn't it? Cat and can crochet.
like it really fits in with the
Really
personality.
fits. Like.
Where did you do your med school? Give me a
Oh
little
yeah,
bit of
that's
background.
the thing. So I did graduate entry medical school. So I did a degree in neuroscience before my medical degree, and then went to the University of Warwick, did my medical degree, and then did my F1 and F2 in Leicester, and then now I'm down in the just like southeast of the UK.
Yeah, we're in a little town called Chichester,
Yeah,
about an hour from Brighton, and it's really sunny. I love the weather here. I don't know what it was like in Leicester,
not
but
it's not at the moment, but
not at the moment. But generally, it's quite nice and
generally
sunny.
it's nice. Yeah.
Um, but yeah, so we'll get started. Enough waffling. So my first question is, Abby, why did you choose emergency medicine?
This is a story I quite like recounting. So, like all through med school and bits, I didn't see myself as an emergency medicine doctor. I was die-hard pediatrics, and that kind of carried all the way through F1. And then I had a emergency medicine job as an F2, and completely fell in love with it. Like I didn't dread going into any shift. Yes, I was tired, but I loved it. All the shifts went by so quickly. I was learning a lot, and I could sit there and chat to anyone. And I got on well with the regs and the consultants, and then I started thinking, actually, no, I quite like this, but I've like poured so much effort into pediatrics, and like my entire portfolio is pediatrics based. And I got chatting to one of the regs who also happened to have gone to the same medical school as me, and he's basically said, look towards you being a consultant, because that's what you're going to work as the majority of life. Do you want ward rounds, clinics, follow-ups, having to go home and think about what you're going to do on the ward the next day and follow up outside of your like working time? Or do you want to come in, do your work, wrap it up in a nice little bow, and go home and have some admin work, but no clinics or anything? And that was it, really. That kind of cemented it for me.
No, I love that you say that because I've always been conflicted between radiology and emergency medicine, and they're like poles apart. Everyone looks at me
Yeah.
like I'm crazy because I'm just like, oh, I've applied for radiology and ACCS, but I like interventional. I like the patient side of things, which is why I love emergency medicine. I
Yeah.
like acuity, and I like technology. So radiology gives you a lot of the technology bits. And ACCS, I again fell in love with ACCS as an F1, my internship back home,
Mm,
because it was really high intensity. But I was very organized. It was very
yeah.
chaotic in my country because we had so many patients. But it was very satisfying when you had like when you'd organized all of it, and I'm like,
Yeah.
hell yeah, yeah. Look at my beautiful master chart
Yeah.
of all the
And
investigations.
the
I'm so
consultant's
happy
like,
about
can you tell
it.
me what's going on with your patients? And you're like, yes, I can.
I
Like,
can. I know exactly what's wrong with them. And I fixed it. Like,
I think that's it, isn't it? You're just like working under your own steam, and
yeah,
you don't get that a lot as a junior doctor or
yeah,
resident doctor now. But yeah.
yeah. But I think again, when I came to the UK, I liked that there was a lot of you were given a lot of support, but you were also considered competent enough to
Yes.
see patients, to make decisions. Obviously, everything went past a consultant or a registrar, but they didn't infantilize you. I think a lot of training programs, especially here in this setting, tend to infantilize you a little and are quite
Yeah.
concerned about you making decisions as a clinician. But I like emergency medicine for that uh, for that reason, where it
Mm,
gives you the autonomy, but also enough support. Like I like how supportive the departments are.
yeah.
So yeah, I love that story. I've never heard that before.
Have you not?
We've never had a conversation about this. This is great.
I feel like I've told everyone.
Aw.
But yeah, it was my favourite placement in med school as well. Like, not the adult department, but pediatrics department. So, in ED. So it was kind of, I suppose, there from the onset, but I just didn't realise it.
Yeah, sometimes I think it takes a little bit of time for us to recognize what we want to
Yeah.
be good at and what we want to do for the rest of our lives. I loved pediatrics. I had a great pediatric rotation, but I realized I was emotionally not like
Yes.
strong enough to look at to look at unwell kids. They were very cute, but I was just like, I'm gonna go home in bits and pieces. Like
Yeah.
I'm just every day. And I'm just like, no, I can't. And I loved the rotation as well.
Yeah.
I recognize that. Yeah. Okay. So we'll move on to question number two.
Mm.
Can you tell me a little bit about the ACCS training program and um, how has it been till now? The
Okay.
good, the not so good as well.
um, so ACCS training programs are a little bit complicated in the fact that there's essentially three specialties that can go through the ACCS program, and that's emergency medicine, anaesthetics, and acute medicine. If we just focus on EM for now, so the only way to become an emergency medicine doctor is to apply for ACCS. It's not like the others. There's no core run through program. It's just ACCS. Um, and then you apply in the first 2 years. You do 4 rotations, which is EM, acute medicine, ITU, and anaesthetics. And then your final year in emergency medicine, you only have 1 year. So you'll go back to your parent specialty and you're there for a year and then you'll go on to ST4. So the nice thing about it is that you can choose whether it's a core or run through program. And run throughs particularly nicer in this economy. Well, job economy in the UK. So I've got job security until I become a consultant, which is, if nothing else screws
Really
up, then
fun.
yeah.
No, I completely agree. I think the run through program is always nicer because you have less of a hassle to like
Yeah.
think about applying again and then applications and then interviews and it's not great. We've got a stressful job, guys. We don't
Yeah, we
need
don't need
any
anything else.
more application stress. Like can't be bothered. Um no, but it's really interesting you say that. So from a portfolio perspective, do you need to have experience and competencies in anesthetics as well, in acute medicine? Like, what's the portfolio like?
So I'm still getting to grips with it myself. It's yeah, it's quite a big thing to wrap your head around, but you'll have certain competencies that could be done only in ED, and then the rest are tend to be focused towards ITU and anesthetics, and maybe some in acute med, depending on what you get. Um,
Mhm.
which is one of the bizarre things I find. Like, I know it's a program tailored to three specialties, but when you've got one of them which is only ED bound, then
Yeah.
it's a bit peculiar. But it's yeah. So you have to get a broad spectrum of things, and they all theoretically could be done in ED, bar a couple, but you won't see as much in ED as you would with the other specialties. So you go through all that. You have to get, instead of it just being a tick box exercise, you get signed off as per what your supervision would be. So you have a scale of 1 to 4, and you need to be all ones by the time I think you hit ST4, at the end of ST3. And so in ST1, you're kind of expected to be at like fours, threes, maybe the occasional two, and then you'll start going up and up through the years, which is quite a nice way of doing it because it's not just like it's a little bit more. Yeah, it's a little bit more control going, actually, like I can do this procedure and look how well I've progress over the years rather than just, yeah, cool, I've done it. I did it on a dummy in a course about 3 years ago. So yeah.
No, I like that. I like that it's more practical. But I also agree that it is an unusual program because
Yeah.
you're rotating through. If you think about, say, core surgical, you're rotating through surgical specialties. Here we're rotating through three independent specialties.
Yeah.
But I think the rationale behind it is it gives you a broader perspective of, if I am referring to acute medicine, what happens to the patient in acute medicine? And then if I need to call anesthetics for airway support, what is it like from an anesthetic perspective? But honestly, I don't know. Maybe they just did it randomly. Who knows? That's just my. I think I'm trying to like rationalize the training program in my head.
It's like apart from GP, it's the only training program where you have to go to different specialties as part of your training
Yeah,
program.
yeah,
It's
yeah.
like I'm quite looking forward to it though. Like ITU and anesthetics will be really interesting, and I'm really looking forward to that bit. But
Yeah, yeah, yeah.
yeah, it's
Me
very
too.
much
I think
like
I really want those skills. I want to do intubations. I
yeah,
want like intensive care experience. And I think even acute medicine, like I haven't seen a ward since I moved to the UK. It's crazy. I haven't been on a ward. But yeah, I think I'm quite excited for the variety of it. I think that was another
yeah,
reason why I was interested in emergency medicine, was the that we get to see everything,
yes,
and I just get to see a bit more of everything.
yeah, which is
Yeah,
fun.
that's very cool. Thank you for explaining, because I actually didn't know that that's how the portfolio works, but that's very
Yeah.
cool. So how has training been so far as an ST1 in ACCS EM?
it's been interesting. So I started on ED. Depending on the deanery and bits, you'll start in different areas. It's not necessarily you're an ED trainee or start an ED. One of my friends up in Midlands actually had an ED rotation last.
Okay.
So I was lucky enough to start off in ED. It was beginning of summer, and we're in a bit of a unique spot in that we get a lot of injuries coming up from the beach and bits, which is quite popular. So I've really enjoyed it. The rota's been tough, but that's because it's a tough, like junior rotas in ED are tough anywhere. Um, but I've we've had quite a lot of teaching in the department, which has been lovely. I've gelled quite well with the registrars and our like senior ACCS guy.
The
And our
SHOs,
clinical
the
teaching fellows.
SHOs, and the teaching fellows. Oh.
So it's been nice, but it's just more like the ACCS perspective. I've been able to get a lot of like help and bits from them guys, and have been quite a lot of mentor sort of to me. So yeah, it's been a nice introduction, and it, I don't know, it just felt nice to be back in my own specialty and be like, yeah, this is what I applied to do, and I'm glad that I've done it.
Yeah, I agree with what you're saying. I think the part about juggling clinical work and a portfolio can be really hard at
Yeah,
times. I remember my F2s having to do CBDs, DOPS, and because they were in the foundation training program, but I was
yeah,
LAS. So I had an appraisal, but I didn't have as much commitment to meeting the guidelines of the F2 portfolio because I'd
yeah,
already done my foundation training back home. But I saw the stress it puts on people, and if you're not as supported, it can feel quite overwhelming.
yeah. It's
And
it's
yeah,
it's annoying really, because I don't know about anyone else in the program, but I tend to go through waves of like, oh yeah, I have a portfolio, and like completely forgetting about it. And you actually you see some like really interesting cases in ED, and they can be pretty straightforward medically, but you then start thinking about the wider implications and the social and aspects, and you do tend to learn quite a lot from them, but it's really hard to put that in your portfolio because you quite often need someone to be like signing off on it, and you can't do that if it's 3 o'clock in the morning.
yeah.
So it's yeah, it's one of the more difficult ones, but I guess I've got 3 years to sort it out.
Yeah. No, but when I look at the medical students as well, the ones that I'm teaching, they
Yeah,
have so much pressure to chase sign-offs and to
yeah,
chase just chase like people for the sign-offs. And I'm just like, but are you actually learning anything? You've got the signature, you've written something up, but
yeah,
have you learned anything meaningful? So I oftentimes find myself questioning that. And I think with training and being a full-time job, because medical students obviously have that brain space and the
yeah,
capacity to chase people, but you've got a full-time job, you've got a life, and you've got a portfolio. So I think it's hard. I
yeah,
honestly, I have a lot of respect for you because that's one thing. I mean, I've generally been good at doing things, but I do things I like. I've never had to
yeah.
do things I might not like. So, yeah, I'm
That's
gonna
the
hit you up
thing.
again for advice.
It's just it's artificial. Like I will quite happily stand there and talk to anyone about what's interesting about a case, but you put me in front of a laptop to type it, and I want to do anything but.
It's the whole reflective practice. I think it's easier if they ask me to record a video, put a camera in front of me and
Yes,
just talk, I'd be able to do it easily. But then again, writing it down, getting the time to do it, getting like the brain space to do it takes longer. And I think it
yes.
becomes a challenge. But maybe you can submit a video as a reflection and be like, I was really pissed off at 3 in the morning and tired, and I had to do this. So I did it. No, but I heard a story where someone wrote a poem as their reflection for something. And I'm
Oh, I
like,
love
if
it.
that's allowed, surely a video should be fine.
For med school, we had for the electives, you could either write a how many word reflection, and then there was another option which was do something else, but you have to do 1,000 word reflection. And of course, I picked the something else. I literally just made like a memory box of my entire elective, and like all the photos I'd taken got put in there, and I'd written on the back of them all. And I'm
Oh,
like, I'd actually taken a lot more away from that than I would have done writing a thousand. Well, I did have to write it, but
yeah.
yeah,
No, no, but
shoeboxing.
I get it. I did something similar for I did sort of electives in Greece and Germany, and I have all like the ticket stubs from like
Yeah.
museums and like random crap because I'm a hoarder, so I have like a box at home of like random crap I collected. But it feels really nice to look back on it, and
Yeah.
I'm sure if you read your essay like 10 years from now, you're gonna be like, "Fuck, that was cool. That was a good time in life. Like, that was great."
I didn't know how good I had it about that.
Like when you're like a consultant and you're getting like angry emails and you're like, damn it. That was so nice. But yeah.
Yeah.
So moving on from what training is like right now and looking at how to actually get into training. Um, so the MSRA is the big bad wolf in
Mm.
the training program and getting into it. So can you tell me about how you prepared for the MSRA first?
Um, I'm not sure I'm the best example, really. So I didn't think I was getting anywhere near a job interview. I sort of chucked in my application as a bit of a, oh, let's just do it and see what happens. Obviously, I wanted to do ED. It wasn't a case of me just chucking in a random application. Like, I just thought I wouldn't get it.
Yeah.
So when I got the invite to do the MSRA on my birthday, which was quite nice,
Oh,
yeah, I was in, what rotation was I in? Renal transplant? Yeah, I was renal. No, I wasn't. Geriatrics at the time. Um, I kind of went right. Okay, so we were at the beginning of December. I knew that I had there was a load of strike periods coming up. There was Christmas to get over, so I thought, right, okay, I'm not happy in my rotation at the moment. I'm really miserable. I'm just going to give myself after Christmas just to have some time off. And then after Christmas was when I started, and I think my exam was on the 14th of January. So I literally went from about, oh, I even want to say like New Year's Day to the 14th of January, and I just sat on pass med and just rote learned everything. Um, Again, not sure if that's the best way to do it, but it was very much like I say to everyone in the ED department, I've actually stumbled through my application, not really sure what I was doing. Exactly the same for the MSRA. So pass med is your best friend.
No, but it's probably a testament to how clear your concepts were throughout med school, because even though you had less time to prepare, you got a good enough score to get in. So with the MSRA, I've realized as well, because now I know my score, and I'm not
Yeah.
telling anyone now. I will make a video.
You
It's
got your
more
score already?
content. Yeah,
Oh, you
yeah.
did radio.
The
Oh, you did radiology. Yeah, okay.
ACCS released the scores. So
What?
mine, yeah.
I
Uh,
didn't get mine till after my job offer.
That's what I expected, but then apparently they released the score. So when I went back on my application, yeah, I've got 553. Uh,
Telling me.
but yeah, but I spent a year. I took a year off, so it's fine. Um, I didn't prepare in 15 days. Let's. But my point being, I realized after the exam, had I spent 6 months or had I spent 1 month, it would have made no difference. Like
Yeah.
it's such a bizarre exam with the SJT being 50% of the exam and
Yes.
50% being really brief clinical questions that
Don't
you're
have
not.
as much detail as you need in them. Yeah.
Yeah, it's a bit of a crapshoot, and no matter what someone tells you, oh, they knew exactly what they were doing and they were like 10 out of 10 prepared, I don't believe them.
No.
I think they're lying. Because like this exam is stupid.
It's like, so I'm on a group chat with a couple of guys who are extremely intelligent, are very like academic. I'm not. I'm just there for the vibes. But one of them's one of them's in want to be neurosurgeon. One of them's a want to be urologist. There's two consultants in the group chat already, and then there's us kind of juniors. But they were saying like the only reason so many specialties have taken up the MSRA, including neurosurgery, and there's not even a vague neurosurgery question in
There's
there.
no there neurosurgery
No,
question.
I was literally chatting to him. I'm like, how the hell are you motivating? Because at least I can try and like spoon it into ED. And it's just because they need to crack the numbers down of people applying, and that's the cheapest and quickest way to do it. So you're going to have neurosurgeons being asked what the third line treatment for heart failure is. Not, yeah, it's
Yeah.
such a silly,
It
yeah,
it it reminds me of exams back home because we have a competitive exam to get into training as well. But that's
yeah.
because my population is like 10 times or 100 times compared to the UK,
Here,
which I mean logistically they can only do that.
yeah,
But I mean I think they're struggling with the number of applicants coming in, so they don't really have much of a choice. But
no.
that just makes it a bad assessment. Like the SJT has also been removed from the foundation program entry point as well.
I was
So,
one of the last years to take that. So
oh, did
yeah, that was
you?
very bitter. Yeah,
But that's
yeah.
probably what
I
helped you,
won't
to
go
be
into.
honest. Yeah, that's probably what I'm really trying here, Abby.
Yeah, it's it's just it is what it says in the tin. It's an exam that everyone has to sit to try and knock the numbers down. And I think you can prepare for it, as you said, for 1 month or 4 months. You'll still be the same because you'll probably be sick of it by the time you get to the end of that 4 months.
Yeah.
So it's just kind of one of those things you have to grit your teeth and get on with it until NHS England comes up with a better way to do things, or is it NHS or whatever,
Health education.
Oriel.
Wasn't it
Yeah,
HE at one point? But yeah, now they're all the same.
yeah,
Uh, but yeah, I agree. So, Past Medicine was a really good resource. For
yes,
me, I found MCQ Bank to be good as well. But
yeah,
at the end of the day, it doesn't matter. As long as you
no,
know the content, the question bank helps, but there's only so much it can do.
yeah.
Uh, and then
And it all depends
yeah,
on the exam and what
yeah,
kind of exam you get. So one of my friends had like really heavy hematology based questions. I cannot for the life of me remember what I had. I think I've just kind of blocked it out of my memory. But I was just lucky that they were my stronger topics. But yeah, it's yeah,
yeah, yeah. The exam's very variable. it's a bit of a crapshoot. They try to cover generally the same curriculum, but sometimes you get more of one specialty than the other. It depends on what day you take the exam on. Like there's so many variables. It's a bit weird. I'll make a video
Yeah.
about it, but that's mostly going to be me complaining about these
Yeah.
exam, I reckon. I'm just gonna rant. That's gonna be the video. No resources,
Therapeutic.
only ranting. We can probably do it together. We can be like, this fucking exam sucks. Like change it.
I am forever scarred.
And then one of my consultants was prepping me for the interview, and he goes like, us as consultants were having a discussion, being like, if we had to take this exam, probably none of us sitting in this room would have gotten through. And I'm just like,
I would.
yeah, because it's a
Oh,
stupid fucking exam. Like,
I would love to see that because it's also it's not clinicians that write it. It's like a working psychology group.
yeah.
So it's not even like doctors or whatever writing this exam. It's really. I'll find out more and send it all to you. But I was just sitting there going, my entire future is decided by this, and it's not even a doctor writing it.
And it's also sometimes, if you look at the SJT, it feels like an English exam where they're like, they
Yeah.
want you to figure
Right.
out, figure out maybe it might be this or it could be that. And I'm like, why are my English comprehension skills being tested in this exam? Like, what does that have to do with me being ethical or me being a good doctor? Like, it doesn't assess anything. Okay, but uh, I'm really like all of my scars are really new, as you can
They're
tell.
showing now.
I know it touched a nerve. Okay. So we've talked about the MSRA, and
Yeah.
from there we go on to the interview. So how did you prepare for the interview, and what was that like?
Again, I wasn't expecting it, so um, I very low self-esteem over here. So I literally, because there's nothing on ACCS interviews out there. You can look everywhere, but it's so vague. Even on the interview prep websites, it's just kind of it doesn't even tell you how many stations there are. So I think it's quite heavily non-disclosure agreements. So I'll be careful what I say. But
Yeah.
I just went over all the basic ALS protocols, thought about scenarios that I'd seen in ED, and then there's a book that has, I call it the chess book because it looks like it's got like a checkerboard on the front cover. And I remember sitting on, because I was on a run of nights, stupid idea to do it after a run of nights, but I know I had quite a lot of downtime, so I'd sit and there was a page with questions and I'd sit there and write out my answers. So I couldn't predict what was coming up, but at least if they asked me a question that was vaguely in that ballpark, I could have bullet points to draw off on instead of just going all the way through. I probably still did that, but
No, but that's really good advice. So you prepped with whatever time you had,
yeah,
with in a difficult situation where you're on a set of nights. And I'm the same. This whole week I have shifts, and like I couldn't find swaps, so I was just like, I'll do the best with what I have. And I think
yeah,
that's a part of being an ED doctor, where I can tell them in the interview, I worked this whole week and I'm still here and I'm still fighting, and that's what matters. And I'm really hoping that they agree to that. No, but I think that's solid advice. I think writing down the bullet points and having
yeah.
things to talk about, because I again had one of my consultants was prepping me today, and she asked a question, and then I ran out of things to talk about, so I started bullshitting a little, and I think she could tell, and then I just honestly went, I'm just waffling at this point, like I have no more talking points, and she's like, yeah, that's understandable, but yeah, I think having the major themes and the bullet points you want to cover is a good idea.
Who was saying?
Um,
Was someone saying about this the other day? Oh, that was it. I was in Acute Med and they were randomly talking about the PACES exam, and I'm sitting there looking smug as hell because I don't have to take PACES. And they said that if you like the best thing to do in an interview or an OSCE situation is if you get to the end of the time, don't start waffling and rambling. Like just end it there, because if they want you to say something else, they will help guide you. Or if you said it all, then you don't need to say anything else. So it's just being comfortable with that silence at the end.
Yeah, I think I really struggle with that because I try to fill the silence and I'm just
Yeah.
like, I'll keep talking, I'll keep talking. And someone just has to
Pages
go like,
interview.
shut the fuck up. Like, please stop. And I think I'm gonna have to mentally stop myself and be like, this is it. I've said everything I had to say
Yeah.
about this question. Yeah. Okay. So we've done life as an ACCS trainee, as an ST1.
Yeah.
We've done getting into ACCS. So we've done the MSRA, we've done the interview. Looking back at all of the things that you've done, and honestly, I don't think you've stumbled through. I think you had a skill set and I think you underestimated yourself. I think you're a very
Oh,
capable
thank you.
emergency medicine doctor, and you're only here because you were meant to be here. That's what I believe in anyway.
Oh, thank you.
Uh,
But yeah. I
but
don't believe that, but that's fine. I'll let you believe it.
I believe in you, Abbie. 110%. I think you were supposed to be doing what you're doing. But looking back at everything, is there anything you would have done differently for the MSRA and the interview?
MSR, I think we've basically covered the MSRA in that it'd be a no. But
No, the
maybe
exam
more
sucked.
time.
Yeah.
Yeah, maybe more time, but I know that I'd get bored, I wouldn't do stuff. Like, so actually the time pressure worked quite well for me in a weird way, and this is gonna go off on a separate tangent, but I wish that I hadn't applied for all my accommodations in the MSRA, because it massively limited my date time. I didn't get a choice on my date and time, whereas as other people did. So I wouldn't have mind travelled for an exam that was maybe a little bit later in the day at 11 o'clock rather than 8 o'clock in the morning. I'm not an early morning person, so but that's like a whole different rant. Interview wise, I wish that I'd read a little bit more about the structure of training. So PEDS, I had it all worked out, but because emergency medicine was a bit of a latecomer choice to me, I was still not entirely sure. So um, I think I would have spent a little bit more time on the RChem website. Um, but yeah, I think I kind of did the best of what I could do with what I had it. So I also wouldn't book it after nights, because that was
Yeah.
horrible.
Um, yeah, I think you obviously did very well with the situation. But honestly, it's a testament to all of it because most people would have crumbled, I think, under that pressure of one having 15 days to prepare, to doing the interview after a set of nights. But again, give yourself some credit, Abby. You did very well, and you're here. Um, and that's a skill set. You knew you had less time. You prioritized what needed to be done, and you did the best that you could.
Oh, thank you. I'm going to come to you with my self-esteem's low in the future.
Yeah, I can like compliment you till the day is gone. I'll just send you voice notes. Abby, I'm gonna send you
Yeah.
like 20 voice notes when you're feeling like crying on the emergency floor or something. Just like listen to it. You'll be like,
Help,
you
find
got this,
emergency
Abby.
medicine doctor during a ward round. What is going on?
Help me, get
Help.
me out of here. No, but that's great. That's I will, so for everyone watching, I will put the resources in the description. So I'll put the official Arkham website, some of the bits for the interview that I'm using. I don't know if I'll get in yet, so I don't want to give out advice before I know my result. My interview's in 2 days.
You did
Uh,
the hardest part of the MSRA, so you need to give yourself some credit there.
yeah, I mean, for me, honestly, the MSRA was the big hurdle because again, it's such a random
Yeah.
exam. Because I'm academic. If you give me content to prepare for, I can do well. But this exam was like there was no way for me to improve. There's no parameters for me to judge. But anyway, the interview is talking. And I think as long as I can tell myself to shut the fuck up at the right time, I'll be okay. Yeah.
And also you're a personable person, and I think based on what I've experienced, I think they're looking at personality as well. Are you going to be a good emergency medicine doctor? Not are you just a good doctor? So
Yeah.
you'll be fine.
I think a lot of the consultants told me that, like body language, personality, like they want, and I give this advice to the people I help with interviews as well. They don't want a robot. They don't
No,
want ChatGPT like answers to things, because a lot of people over prep, and then
yeah,
it sounds like they're trying to recall a lot of information, which I mean is fair enough. But you also, it's a conversation. You have to sound like yourself.
yeah,
You have to sound like Abbie. I have to sound like Rupali, and we might have completely different personality types and ways of talking and perspectives on life. And that's the point of an interview. They want to know, I think the best way to summarize an interview is they want to know that you're not a psychopath.
yes.
I think that's it. That's the bare minimum.
I think that's true all the way from med school as well. I think med school interviews are just making sure that you're an actual human,
Yeah,
not.
and you're not crazy. I think, yeah. I think that's the majority of what they, that's the basic of what they want. But I guess we'll find out in two
Not
days.
asking for much, are they?
Yeah, no, they're really not. They're like, you've got a sensible head on your shoulders. You can talk. That's fine. We'll take you.
Come on.
No, but I will make a separate video about what the interview is like, what the structure is like. I agree with Abbie. There's very little information out there to go off of.
Yeah, I think
Um,
it's because you signed a non-disclosure agreement, so
yeah, yeah.
it's difficult. I yeah.
But I mean, some information about the stations and like just from Arkham would be nice. So we
Yes.
have something. We weren't going in. So if we weren't going in blind, I think a lot of people would do better.
Yeah.
Uh,
Or maybe that's
yeah.
what they want, going blind, because technically you're going in blind every day.
Ooh, look at you trying to justify their spiel. Like,
Justify Arkham's lack of information. Like,
yeah, yeah. Thanks, Arkham.
I love you, Arkham. Really, I love you.
Arkham, please take me, please.
I know the president of Arkham liked my tweet the other day, and I was like, I've won in life. I am
Yeah,
like done now.
you're a part of the inner circle now. They
I
got
am. I'm in there.
They're like, Abbie's gonna be the next president. Abbie's gonna make Arkham so much better. You go, Abbie.
Abby's just in the background, like, yay.
Abbie's just struggling to do the portfolio. She's like, what do I reflect on?
And then the extracurriculars, Abby's just keeping above the water at the moment. We're good.
Abbie is being an ST1, and that's all Abbie
Yeah.
needs to do.
Yeah.
No, but thank you for all of the advice. Thank you for sharing your experiences. I hope it was really helpful for me personally, but I
Yeah.
hope it's helpful for the people watching. If you have any questions, you can obviously put it down in the comments. I will pass on the questions to Abbie. If you have a LinkedIn, Abbie, if you'd like people to reach out, that's something we can do.
I
If
don't
not,
have LinkedIn, but I have social
no.
media. So
Social media, yes, we'll take something. But if not, I'm happy to pass on the questions and I'll answer anything in the description. Other than that, I'll make a lot more videos with trainees from different specialities. We'll have open, candid conversations about the things we like and the things we don't like. Probably off camera, a lot of the don't likes, but because we like to keep our jobs as well. No, but open conversations and giving you a
yeah.
realistic perspective on what training is like, and hopefully we find it helpful. So like, share, subscribe. I find it very cringe to say that, but thank you for your time, Abbie. I really appreciate it.
Thank you and good luck.
Thanks. Um,